my name is Janaina Koenen. I'm a doctor. I'm an endocrinologist and specialist in metabolism. So, why does cancer appear in us? Why do we get cancer, right? Because cancer, lots of doctors are talking about cancer is a genetic disease. So I learned it like that 20 years ago when I graduated from med school. I graduated thinking like that cancer was a metabolic disease, right? Until I did all my studying, my master's degree and everything. My dad got cancer, and then I started studying a lot about cancer, about metabolism, and I started reading a lot. And as I'll show you, and I'll tell you about some books you should be reading, right here in my YouTube or my Instagram and my social media and everywhere, you'll notice that cancer is not a genetic disease. You know why? First, because only 5% of cancers can be explained by a genetic mutation. Second, because we have some studies showing that we have cells that don't have any mutation and get cancer. And we have lots of studies showing that we have mutations with no cancer. For example, there's a prostate cancer study in which they follow the patients along their lives, right? And you have these patients here and these ones here. These ones got cancer and these ones didn't get cancer. And along their lives, the mutations, they grew in number the same. They were identical. So they have the same number of mutations. And half of them got cancer, half didn't. Why is that? What influences cancer? So, of course, it's not only one thing, because if it was, everything would be solved. We wouldn't have so many drugs being released into the market without enough studies, right? Very expensive without a very clear advantage for the patients, right? But I can tell you that we know for sure some things do. So let's talk about this, okay? We know, for example, that lots of tumors are related to obesity. The CDC released many years ago, they have this figure, this very nice one, I'll show them to you here, okay? In which they point out all these cancers, these organs that in which cancer is caused or influenced by obesity. Completely different organs, nothing to do with each other, but they're influenced by obesity. So insulin resistance, it's a cause of cancer. Insulin resistance, so diabetics should have more cancer? Yes, they do, they get more cancer than non-diabetics. That's why nowadays we have to screen diabetics earlier for lots of tumors, different tumors, because they get them before. Okay, so insulin resistance, it's a big, big factor influencing cancer. Okay, so diabetes, obesity, especially visceral obesity. Okay, because the visceral fat, the one between the organs, it's inflammatory. It's not inert, it produces hormones and cytokines. It increases your risk of heart attack, of Alzheimer's, and of cancer, of course. So if you have visceral fat, even if you're lean, but you do a DEXA scan in which you can see your body composition and you see you have a visceral adipose tissue, which is more than 400 grams, for example, like 1,000 kilogram of visceral fat, you're in risk, okay? So this is something we have to acknowledge, accept it, and change it in our society. Second risk factor, which is very important for cancer, is inflammation, chronic inflammation. Being obese, right? Obesity triggers chronic inflammation, or from your leaky gut, from your intestines, because we know for a fact that many people nowadays, they have irritable bowel disease, or they have inflammatory bowel disease, or even only a leaky gut, but they have symptoms. They feel bad after they eat, they have diarrhea, their poop is not like cute, it's like pieces, or it's like only small balls like this, and you know for sure that this person is not healthy. And we do know for sure that microbiome is a hallmark of cancer in the last papers published, last year actually. So your microbiome is very important, being it vaginal, being it your bowel. So inflammation, being it from your intestines, from obesity, from excess physical activity, like professional athletes, very inflamed professional athletes, pushing it to the limit. They have bigger cardiovascular risk. and they also have cancer risk. So physical activity is good for you. Yes, it is, but not in a way, not up to the limit in which you're getting sick and sick. Okay? What other kinds of inflammation do we have? We have inflammations from autoimmune disease. So if you have an autoimmune disease, you're chronically inflamed, you have a bigger cancer risk. So you see, and you have subclinical inflammation. Subclinical inflammation, Janaina, what is that? It's an inflammation that doesn't give you any symptoms, like teeth problem, for example, periodontal disease. So you have periodontal disease, and you have a high PCR, like a C-reactive protein, chronically elevated. So you have an inflammatory condition. This increases your risk of cancer. Why is that? Why is inflammation raising your cancer risk? Why? Because when you have high inflammation, chronic inflammation, your immune system stops making surveillance for cancer cells and starts looking at your inflammation. So the immune system is a key factor in cancer. Why is that? Because we get cancer every day in our bodies. Every day we get cancer, right? But our immune system detects it, goes there and sends a message and tells that cell, you have to die right now. And if the cell doesn't trigger itself, the apoptosis, right? So a cell that's not working well should die by itself. If it doesn't, you have a natural killer cell, a T lymphocyte goes there and kills it, eliminates that cell. Okay? It's not my cell anymore, it's different. It went rogue, so let's kill it. So it happens every day. So why is that? That suddenly our immune system is blind and it doesn't look anymore. It doesn't find the cells. Why? Because our immune system is too busy looking at your bowels, at your irritable bowel syndrome, or at your periodontal disease, or at your autoimmune disease, or you're chronically stressed and overwhelmed, working 18 hours a day and you don't sleep any longer. So you have emotional stress, burnout syndrome. So if you have emotional stress and burnout syndrome, your cortisol levels are high, your adrenaline levels are high, your sympathetic nervous system is hyperactivated. So this may change how your immune system works. And your immune system may stop doing surveillance as well. So once you get the cancer, and once the cancer is already multiplying itself, the cancer itself is working against you, and it's turning your immune system into his favor and against you. So your immune system starts working for the cancer. Okay? And that makes it harder for us to treat, but not impossible. We do have supplements, we have mistletoe. We can change this if you change your lifestyle. Okay? So if our lifestyle is all increasing your cancer risk, how come you can treat a cancer without working with your lifestyle and changing your terrain? It's impossible, right? Think about it. So inflammation, immune system, sedentarism. So physical activity, exercise is very important for you. It's important for preventing cancer. It's important for treating cancer. Not excess exercise, regular exercise, gentle exercise, like working out 3 times a week, walking. But strength training is very important. Having lean mass is very important for longevity. So it's good if you do aerobic and resisted exercise, okay? Janaina, but you said inflammation causes cancer and exercise triggers inflammation. No, exercise triggers acute inflammation, which is good. You tear your muscle, you repair it, that's acute inflammation. What causes cancer is chronic inflammation. It's something that never changes. It's chronic. Exercise, doing it in the right way, actually is anti-inflammatory in the long run. And we turn on genes which are protective for us. Not only for cancer, but from dementia too. So think about that. Doing exercise, okay, turns on good genes, turns off bad genes. It works on insulin resistance too, because when you do exercise, you sensitize your muscles to insulin. So you lower your insulin in the long run. So that's great, okay? You gain muscle mass, which is also good for longevity, and it's anti-inflammatory. So exercise is a win-win if you do it in the right way, okay? Diet. Come on, guys, you know that for a fact. If you eat ultra-processed food, you get fatty liver disease, you get diabetes, and everyone is telling you, oh, stop eating meat. You don't have randomized clinical trials or good evidence to tell you to stop eating meat. Meat doesn't give you cancer. It never did. Okay, the only meat that gives you cancer is the hot dog meat and the pepperoni from your pizza that you eat with your soft drink, right? Your sugary drinks, full of corn syrup, right? High fructose corn syrup. So that gives you cancer. I'm eating this hamburger. So it's the meat from the hamburger, or is the bread from the hamburger and the ketchup full of sugar, the mustard full of sugar, and the soft drink and the French fries fried in seed oils, in vegetable oil rich in omega-6? What do you think? Because we have a whole school, very respected one, publishing every year in the same cohort. It's an observational study, lower level of evidence, right? The same cohort, every year a study comes out, right? And the information they publish is very misleading. And I'm sorry for you that you have to go through this. I'm sorry for you that doctors are fighting over veganism or meat in the social media. But I'm here to talk about evidence-based medicine. I work with evidence-based medicine, and I owe you at least that, okay? So, for sure, what can cause cancer in the diet is processed food, sugar, additives, and of course, the endocrine disruptors, the plastic and bisphenols and the pesticides, right? So the environmental contamination, the heavy metals, yes. But from food, something you really can do about it is go organic, right? Get off pesticides if you can, glyphosate if you can. Get off processed food. Start eating plants and meat and real food, okay? Not something that comes from a package. Think about that, yes? Try to have an anti-inflammatory diet. The Mediterranean diet is okay. It's not like the only good diet. Yes, a low-carb diet, a low-carb Mediterranean diet. It's a much more balanced diet. You can do that. Eat less. Eat until you're 70% full. Don't eat until you're stuffed. Let your body heal. Do intermittent fasting. Intermittent fasting is the way we evolved. Our species evolved. We didn't evolve eating every 3 hours. That's not physiologic. Is it? It's not. So, intermittent fasting is a great way, right, to clean up our body, to do autophagy. We can talk about this in another video. Eating anti-inflammatory diet and just get away with the ultra-processed food. Avoid excess alcohol. Alcohol is mutagenic, especially women. You see women, breast cancer, 16% of breast cancers diagnosed in the US are related to alcohol use. And not a lot of alcohol. It's like, if you get 2 glasses of wine every day, it's a lot. So reduce alcohol intake, okay? Sleep better. We know for a fact that insomnia and sleep apnea increase your cancer risk. Shift work increases cancer risk. So we're sleeping less, sleeping in the wrong time, and sleeping poorly, right? So you have to get to bed at 10 the most. Sleeping before midnight is interesting. So we have circadian rhythms. We have biological rhythms in our bodies. So it's not only about how many hours you're sleeping, especially if you're taking sleeping pills, benzodiazepines. So, okay, so you have to get good sleep in the right time, which is usually around 10 p.m., and sleep well. So if you have sleep apnea, forget about it. Treat it. You need a CPAP. Okay, so you have to get diagnosis. If you snore, please run. Get yourself tested. Do a polysomnography. If you don't snore but you sleep poorly, get tested. Talk to someone. And don't take benzodiazepines. Try something natural like melatonin. Melatonin prevents cancer. Actually, one of the reasons shift work causes cancer is because you don't produce melatonin in the right amounts in the right time. So melatonin prevents cancer and treats cancer. It's like the pill of God. It's the hormone of God, I think. Melatonin is like essential, really. Okay? Stress management, we talked about it, right? So depression, anxiety, they all cause cancer, or at least they increase your chances of getting cancer. And if you have cancer and have anxiety and depression, you have a worse prognosis. So my advice to you is change your lifestyle. You don't have to get cancer. And if you do get cancer because your genetics is too strong, you can have a milder one. You can have an early diagnosis. You can have a better outcome in your treatment. Don't let people trick you. It's obvious. We never had so many cancer diagnoses. We're not going anywhere with this lifestyle, with the Western lifestyle and the Western diet. And it's not about the meat. It's about the ultra-processed food. We evolved eating meat, but not this meat. Not meat with sugar in it and nitrates and, with sugar drinks and all these sauces and everything from the package, and eating very fast during lunch because I don't have time. I'm too stressed. This lifestyle is killing us. And we are being deluded, we are being tricked, deceived by the food industry and big pharma. And unless you wake up, you'll be hostages forever. Wake up, get out of the bubble, get out of the matrix, come out to the real world, eat real food, be real people, okay?